Hi, my name is dr.eseosa.ighodaro, and I'm a neurologist. And I'm going to be teaching you all how to appropriately take a patient history. And the really cool thing about this lecture is that it's going to be in two parts. Part of it's going to be on Clubhouse, and you can follow in real time with all my notes on my YouTube channel. So if you go to my Clubhouse bio and click on that link, it'll take you to my YouTube channel because that's where I'm going to be showing you guys how to actually take an appropriate patient history. So be sure to be sure to copy and paste the link that you see in my Clubhouse bio, go to my YouTube channel, and I am live streaming my notes on how to take a patient history. That's what we're going to be going through. So for those of you who are new to this room, my name is Dr. Eseosa.ighodaro. I'm a neurologist and a neuroscientist at Mayo Clinic. And today I'm going to be teaching you all how to take a proper patient history. I've seen many medical students who come in to the service who do not know how to take a patient history accurately. They're skipping, they don't have a system. And so when they come to present to me, they're missing some key information in their presentation. So the first thing I do for any medical student that comes to my service, I teach them how to appropriately take your patient history. And this is going to be a very phenomenal Clubhouse room because I will be showing you guys in real time how to take a patient history. If you go to my YouTube channel, I'm currently streaming live a whiteboard so that you can see my notes and you guys can take notes and use this system so that when you go on to your clinical service, you already know how to take a very detailed patient history. And this is going to require some patient participation. So there's anyone in the audience who wants to help come up and help figure out how to take a patient history, come up. We're going to have, it's going to be a great fun conversation. For those of you who are new to this room, my name is Dr. Eseosa.ighodaro. I'm a neurologist and a neuroscientist at Mayo Clinic, and I love teaching medical students. And the purpose of this room is to teach medical students how to take an appropriate patient history. This is key. This is the foundation of patient care. And I've seen many medical students who do not do this correctly. So I'm going to teach you guys how to do it correctly, efficiently, so that you get the key information and you're able to present in a very systematic way. A very phenomenal thing about this room is that I have a whiteboard streaming on my YouTube channel. My YouTube channel link is on my bio. If you click on that Linktree link, it'll take you to my YouTube channel and you will see my notes live in real time so that you can take a screenshot, or this will also and then you can use this system so that when you go onto the clinical services, you're practicing medicine at the intern level and not a medical student level when it comes to note taking. So I would love for 5 or 6 brave medical students to come up on stage and let's figure out how to take a proper medical history. So who would like to volunteer? Fantastic. Thank you so much for coming up and volunteering. We always have great rooms together anytime we're both on stage. So thank you so much. Make sure you ping your friends, make sure you ping your colleagues and other people, because this is going to be a very phenomenal, groundbreaking room where I'm syncing Clubhouse and YouTube so that you guys can see my whiteboard on my YouTube channel. So be sure to go to my YouTube channel so that you get the notes and so that you can take a proper medical history. Still waiting for 4 more students, so 4 more brave students to come up on stage. And yeah.
So I'm on the YouTube channel now, and like there's just a bit of an issue because there's so Clubhouse is about 10 seconds ahead of the YouTube.
Oh, so that's okay.
It's a bit of a tricky feedback situation.
Oh.
Yeah, no, it is a really cool idea though. I'm not sure if have that issue. But
okay, cool. Well, this is the first time I'm doing it, and I know for me, anytime I'm on Clubhouse, I know there's a lot of students who are taking notes. So it's well, let me show you guys what I'm doing so that you can go back, you can, look at this live stream and, get the accurate notes. But yeah, thanks for pointing that out. I am looking for 4 more brave students to come up on stage so that we can start learning how to take a proper patient history. Do we have any more brave students who want to come up on stage? I promise I don't bite. You can talk to, would you like to introduce yourself? He knows I don't bite.
Yeah, hey guys, my name's Noor. I'm a fourth year med student at England. Fortunately, I gotta start like a ward round a little bit, but I should up and sort of support Dr. Eseosa. She runs pretty incredible rooms. I seriously recommend you just follow her. Like, she has a lot of great content on here. I'm wondering if there's a way to perhaps open the room up just to get, because there's a few people I'm trying to ping.
Oh yeah, there is a way, and because I'm not one of the founders, I cannot. There's 3 founders that usually watch rooms and they let people in. So maybe let me see if I can ping one of them if they're up, and then they can help me let someone in. And we are still waiting for 4 more brave people to come up on stage. The more the merrier, so that we can learn how to take phenomenal patient history. Oh, great. Casa has joined. Casa will be able to help us open up the room. Hey, Casa.
Hello. How are you?
Doing great. So thanks, Casa, for helping us open up the room. So now you guys can ping your friends, ping your colleagues, because this is going to be a very groundbreaking Clubhouse. I'm integrating Clubhouse and YouTube and Zoom. So I am right now live streaming a whiteboard on my YouTube channel. So if you go to my YouTube channel, you'll be able to see my notes on this presentation. And I always say your name wrong. I'm sorry. How do I say your name?
Is that me? It's Noor?
Noor. Okay. Noor. Noor said that there may be a 10-second delay. So keep that in mind, but you get to see my notes in real time. The reason why I'm doing it on this whiteboard is because I want you all, when you leave here or when you're done with this lecture, is I want you to take this whiteboard, and that's how you should form your piece of paper when you go and you ask a patient a question. Do it this way every time. You will not miss any important information, and you'll be rock stars from the patient history. So I'm still waiting for 3 more brave students to come up on stage so that we can, phenomenal. We have Almer coming up on stage. Thank you so much.
Hello.
Casa, I know you're phenomenal and you're always staying up late to help open up rooms. So don't feel obligated to stay in the room, but you're happy to stay. Would you 2 like to introduce yourselves?
Me? Are you talking to me?
Yeah.
Yeah, my name is Ahmed. I'm a second-year medical student at Imperial College in London.
Fantastic. Thank you for coming on stage. Casa, would you like to introduce yourself?
Sure, yeah. My name is Casa. I graduated undergrad last year, and I'm currently taking a gap year and applying to medical school this upcoming cycle, and I'm one of the founders of this club. And
be sure you join Aspiring MDs. Casa and his 2 other colleagues who found this club are phenomenal, and they have taken this Aspiring MDs to the next level. They have mentorship programs. They have weekly Wednesday sessions, and they do a lot of very high yield content for pre-med, medical, and other students, other health professionals. So be sure to follow him and follow Aspiring MDs. So I'm looking for 2 more people, 2 more brave souls. I promise I don't bite. We always have phenomenal rooms. This is your chance to get real-time feedback from a resident so that when you go to your respective hospitals and you present, you would have already presented to me, and I can help take your presentation skills to the next level. So who is going to be brave enough to come up? Fantastic. I am phenomenal. We get a lot of people. Yes, that's what I'm talking about.
Up here.
Excuse me. Hi. Yes.
Nice to meet you. I'm also a medical student from London. I got my hospital placement starting in about a week from now, so I might as well get some practice.
Yes, I love it. Great job. Thank you for coming up on stage. And then we have Elena.
I'm Ilana. I'm actually not a medical student or a doctor, so I love doctors because I've got type 1 diabetes, and I'm very interested in medicine.
Oh, cool. Thank you. Well, thank you for being here. Thanks for being on the stage. So I'm going to restart the room again. My name is Dr. Eseosa.ighodaro. I am a neurologist and a neuroscientist at the Mayo Clinic in the USA. And I love teaching. And so what we're going to do in this room, this is going to be a first of its kind, maybe even groundbreaking, is that not only am I going to be teaching you guys via Clubhouse, I'm making it very interactive in that I'm live streaming my whiteboard on my YouTube channel. So be sure you go to my YouTube channel and subscribe, and you can see my whiteboard, because I want you guys to take my outline and use that when you go and collect patient information, so that you're not missing key components of the patient story. And there may be a little bit of a lag, but in all, this is phenomenal free content from a physician scientist. So with that, let's get started. And if there's anyone else who wants to come up on stage before I close up the stage, you're more than welcome to. Make sure you ping your friends. This is phenomenal, hot content. And make sure you follow Aspiring MDs and follow the people on stage, and follow me, because I do several rooms targeted for pre-med, medical, and interns on sharpening their medical skills. So we're going to get started. So for the people on stage, let's say the case is you have a 50, and I'm writing this on the whiteboard as well. You have a 50-year-old female with a headache, okay? So we're in the emergency room. You're the intern. It's July 1st. I'm the senior resident. I got so many patients to go see. I want you to go see this patient. I want you to see the patient, and then I want you to come back and then present it to me. So, but today we're just going to focus on the history taking component. So for the people on stage, what's your approach?
I start with Socrates, just like go through kind of site onset, the character of the headache, seeing if it's like radiating anywhere, figure out the associated symptoms, and then like kind of exacerbating relieving factors, severity, and then just like go through key symptoms like nausea, vomiting, visual disturbances, photophobia, ask about neck stiffness, rashes, anything else, guys?
Posture dependent, so if it's like worse lying down or it's better like standing up or anything like that.
These are all very great points. So let's take it to like a big picture. So from a big picture standpoint, what's your system? Not so much a specific question, but what's your system?
Sure. So history, like presenting complaint, history of presenting complaint, and then past medical history, drug history, social history. It's in there.
History.
Yeah.
All?
That's how we're talking. Like,
Is that all? Anybody else have anything else to add? So we have the HPI, we have the review of systems, we have past medical history, drugs, and social history. Anybody have anything else to add?
I know it's not like strictly about the history, but just the like expectations of the patient as well, and like the immediate concerns that they have and stuff.
That is a great point. Yeah, very good. So anyone have anything else to add? So we have history of present illness, we have past medical history, we have drugs, we have social history, review of systems, expectations, and anything else?
Well, I mean, just from movies. Sorry, because I'm not a doctor.
It's okay.
And I shouldn't be up here, and I don't know. I'm sorry, but how long have you had the headaches for? When did the headaches start? Have you had any falls? Have you had any blackouts? I don't know.
Yeah, no, those are all
Dr.
those are all great points. So the reason why I'm asking you guys these questions is because if you don't have a system when you're going in, you'll get lost in the details, and sometimes you may forget pertinent information. So for example, I was teaching this concept to students at my hospital, and so I was, let's say a 30-year-old, we keep it the same person. For those of you who are new to this clubhouse, or sorry, new to this room, my name is Dr. Ighodaro. I'm a neurologist and a neuroscientist at Mayo Clinic in the US. I love teaching online. I've been doing several rooms with aspiring MDs, and this is going to be, I think, the first move of its kind where I am integrating Clubhouse with YouTube, with Zoom. So as we're speaking, I have a whiteboard on my YouTube channel. So if you go to my YouTube channel, you can stream and see my notes so that when we're talking, you can look at the whiteboard and take down notes just like you would if you were in the hospital. So be sure to go to my Clubhouse bio. You'll see a link that's called Linktree. Click on that link, and that will take you to all my different social media platforms. Click on the YouTube button, and you'll see my whiteboard. And after this presentation, you'll be a rock star in taking patient history. So
I was just going to say as well, just at the end of like the history taking, just to remember to like summarize everything to the patient and then make sure that they like agree with everything, and if there's anything that like important left out.
Yeah, I'm writing that down. So you guys are missing a key component, and I will give you an example. So 50-year-old female comes in with headaches. You're concerned for maybe she's having migraines, and you want to give her a medication. You give her this medication, she starts breaking out in hives and rashes, her tongue is swelling, and she's starting to have respiratory distress. So what did you guys miss?
Allergies.
Exactly. This is why it's good to have a system, because if you have your system, you'll memorize it and you'll never forget it. So yes, allergies. Everyone always misses allergies, and that can be the difference between life or death for a patient. Let's see. So we're still missing some stuff. We have HPI, past medical history, drugs, social history, review systems, allergies. What are some other big sections in the history that needs to be asked?
Don't they normally ask if you've had any surgeries or
very good. Look at you. Very good. Sorry,
guys, and I'm not a doctor, so you can throw me back into the audience.
No. You hit on a phenomenal topic. Yes, surgery. Surgeries is a big thing. For example, let's say we have a patient, I'm trying to relate it. Okay, 50-year-old patient, female with headaches, and she has I'm trying to think what, I'll just use a heart. Okay, 50-year-old man with a history of myocardial infarction, and he needed stents. He needed 2 stents placed because of coronary artery blockage, and he's on dual antiplatelets. So if you don't ask him about his surgical history, you won't know that he has a stent, and then you may or may not start his dual antiplatelets. So what could happen if you miss the fact that he has a stent placed and is on dual antiplatelet therapy? Why is he taking the antiplatelet therapy? Go ahead.
Are you asking what the complication is?
Exactly. So if you don't give him his platelet therapy in the hospital, and it's a brand new stent, those stents are gonna clog back up, and that's not good. So that's why you need to ask surgical history. What else do we need to ask? Can everyone on stage see the YouTube channel?
Yeah.
Okay, so what?
No, I'm just saying, yeah.
Okay, so I'm gonna give you guys a hint. Go ahead.
Could you also ask like if they've been abroad and stuff, because that could
Yeah, that's
sometimes
good.
be a cause of infections.
Yeah, travel history. That's good. We have another major, and I'll put all this in order once we get through all the pertinent parts. We're missing a major, how do you call it? Subsection. I'll give you guys a hint. 50-year-old female comes in with headaches. Her mom and her brother have also had similar headaches. And it happened all of a sudden. And they had to go to the ICU because they were found to have brain bleeds due to that was causing the headaches. So what could be what could be the reason why this lady now has headaches? She has a family history of her family's going into the hospital because of severe headaches, and they had a brain bleed. What's the connection?
Isn't that a gas leak in a house or something in the house?
It's something related to the brain.
It's probably, maybe they have some trauma incident.
No, is it the Paris aneurysm?
Yes, exactly. Berry aneurysm. And so,
oh my God.
Yes. So what section did you guys miss? What section did you guys forget to ask about?
Well, like, would that not be under family history or?
Yeah. Did you guys say family history already?
Yeah.
Oh,
like,
cool.
Like usually we put I put allergies under my drug history too, but yeah, I get what you mean. Like, yeah.
Cool. Okay. So it looks like we have all the big points. So now if you guys go to my YouTube channel, I'm going to, now that we've talked about all the big points, I'm going to erase this and show you how I set up my piece of paper. Before I go into any patient room, I do this so that I don't miss anything. Because sometimes you'll be taking care of 15 patients, and if you don't have a system, you miss stuff. So the first thing I write on my piece of paper is I write the chief complaint. So what's the chief complaint in this prompt?
Headache.
Yep, very good. And then we get into the chief complaint, as you all mentioned, is headaches. So the chief complaint is usually 1 to 2 words as to what brought the patient to the hospital. Then I go into my HPI, which is history of present illness. And I think Noor mentioned Socrates. So there's many different mnemonics that people can use to make sure you hit the key points of the HPI. I like to use old cards. Has anyone heard of old cards?
No, I haven't actually.
Okay.
No.
Okay, so I'll explain to you guys what old cards is. So old cards, OLDCARTS. And it's a mnemonic that I use to remember the different components of the HPI. So O is for onset. L is for location. D is for duration. C is for characterization of the headaches. A is for alleviating factors, A is for aggravating factors. I'm writing this down as I speak. Aggravating factors. And R is for relieving factors. T is for temporal, like time. And then S is for other associated symptoms. Okay, so you can apply this to any chief complaint that you get when you go see a patient. So let's do it for this patient scenario. So 50-year-old female with headaches. So if you use the old Cart's mnemonic, what questions are you going to be asking to get through the old Cart's mnemonic?
Like, when did the pain start?
Good.
And then where it is, like which part of the head maybe.
Yep, very good. So let's say
Did
her.
it come on suddenly, or did it come on immediately? Actually.
Yeah, very good. So you're asking about the temporal. So let's say her headache came on all of a sudden, and someone else asked about the location. So let's say her headache came on all of a sudden, and it was bifrontal. What else do you want to ask? Well, with using,
like, is the headache constant or does it come and go?
yeah. So that kind of gets with the temporal part of old cards. The headache came on all of a sudden, and it reached its maximum intensity within seconds. So sticking with the old cards, what else are you got? What else do you need to ask?
Is it like a sharp pain or like a dull pain?
Yeah, very good. So that gets to the characterizing the pain. So it's a very sharp throbbing pain. What else do you want to ask?
Is this the first time you've experienced this?
What?
Is this the first time you've experienced this?
Very good. Yep, this is the first time she's experienced it. Yeah, very good questions. What else?
Does anything make it worse, like going on your phone, or is there any time of the day where it's worse, like waking up or when you go to sleep?
Yeah, very good question. So that gets to the aggravating part of the old Cart's mnemonic. This pain has never happened before. She woke up, was eating breakfast, and she was fine. And then it just came on all of a sudden. And no matter what position she's in, it's extremely severe. And then that kind of ties into anything make it worse or anything make it better. That ties into the relieving symptoms, and nothing makes it better. She's in constant pain. So I think you guys got all of the big parts of old cart. Now we're going to get into the S of old carts, which is the last thing. So other associated symptoms. So what other associated symptoms would you want to ask in this patient?
Any sensitivity to light?
Yes, very good. Yes, she has. Yep, what is that called?
Photophobia?
Yep, she has photophobia.
Neck stiffness, fever, visual disturbances.
Yeah, very good. So why do you want to, what are you getting at with the neck stiffness and the fever?
Meningitis.
Yeah, very good.
It has to be encephalitis, bacterial even.
Yeah, very good. So she doesn't have any neck stiffness. She doesn't have any subjective fevers. Good. What else is some other important associated symptoms?
Vomiting?
Yeah, she did vomit.
There'll be the vision.
Yeah, very good. She has some blurry vision. So why are you guys asking about vomiting and blurry vision?
It could be increased intracranial pressure.
Very good. Yeah. And if that's the case, that's, a medical emergency. So I'm going to pause real quick and reset the room because we have a lot of people coming in. My name is Dr. Eseosa.ighodaro. I'm a neurologist and a neuroscientist at Mayo Clinic here in the US. And I love teaching. I love teaching medical students and pre-med students. So I've been on Clubhouse doing teaching cases, especially those in related to neurology. So in this room, what we're doing is I'm teaching you all how to take a accurate, thorough patient history. And for the first time that I'm aware of, I am integrating not only Clubhouse, but also Zoom and YouTube. So as I'm discussing, I have a whiteboard on my YouTube channel where I'm taking these notes for you all so that those in the audience can take notes, those who are on stage can take notes, so that when you're done with this room, you will have notes that you can refer to when you go into your hospital setting. So to find my YouTube channel, you can either type in my name, dr.eseosa.ighodaro, or you can go to my Clubhouse bio, and there's a link called Linktree, and that will take you to my YouTube channel. And this is live streaming right now, so I encourage you all to subscribe to my YouTube channel, because I will be hosting these kind of sessions periodically, at least weekly, for you all. So far, you guys are doing phenomenal. So now we've talked about chief complaint. We've talked about the HPI. The next thing, so I'm going to erase this. So after you talk about those parts, then what I go to next is past medical history. And again, you want to do things in a very systematic way so that you don't forget anything, like allergies, like that, that we missed recently. So past medical history, that's very straightforward, right? What do you think?
Maybe if she had hospitalized before.
Yeah, so let's talk in general. So when you're going to ask a patient about their past medical history, how do you do that?
From open question to specific question.
How? Give me an example.
Like for the open-ended question, like any ongoing medical problems, anything I should know.
Good. And what if I say, nope, I don't have no ongoing medical problems. Are you done?
And then we go into like specific, like probably any surgery, like try to remind her about any ongoing medical stuff.
Okay. So let's stick to the past medical history first. So go ahead.
Can you ask, like, are you currently on any medication, and if not, have you ever been on any medication?
Yeah, you could do that. So I want to help you guys focus on each subsection individually. So we focus on the chief complaint, we focus on the HPI. So now let's focus specifically on the past medical history, and then we'll get to meds and social history and certain.
Maybe do you have any chronic illnesses?
Yeah.
Diabetes, hypertension.
What if they say, I don't know what diabetes is, I don't know what hypertension means. Are you done?
Explain more. Do you have high blood pressure, high sugar level?
Yeah, very good. Because there's not everyone has the same what's it called? Has the same medical literacy. Just like if I go to a mechanic and they're saying all these kinds of words, I'm like, I don't know what that means. You need to break it down for me. So just because the patient says, no, I don't have anything in my history, or just because they say, nope, I don't have hypertension or, diabetes, doesn't mean that they don't. So you always want to use what the local slang is for very chronic diseases that are common in your place of practice. So here in the US, things that are very common are diabetes and hypertension. So when I go and ask a patient, hey, do you have hypertension? They tell me no. But if I say, hey, do you have high blood pressure? They say, oh, or do you have to take do you have a blood pressure cuff at home? They say, oh yeah, I take my blood pressure every day and my number is 160. So there's many ways to get around at their past medical history. So make sure you're digging deeper, especially for very common illnesses, so that you don't miss key information. Another example is diabetes. Many people don't know, the term what diabetes means. Some people here in the US say, oh yeah, I have the high sugars, and that's diabetes, but to them it's called high sugars. So instead of saying, hey, do you have diabetes, like someone had mentioned, you say, do you have high sugars in your blood? So, taking it to the next step and really digging and try and get the information out that's pertinent in a way that the patient can, give you the information. And this is taking it to the next level. This is intern, senior resident level stuff. Does that make sense?
Yeah.
Okay. Fantastic. So now that we're done with the past medical history, let me erase my whiteboard. I go to medications. So how are you going to ask a patient about their medications?
Maybe do you take any medications for anything, for any of your illness, or
are you supposed to be taking medications?
Yeah, and what if they say, nope, I don't take no meds? Or what if they say, because many of them do, I don't know. Then what?
Give example, maybe, like over-the-counters or herbals.
Yeah, and sometimes they say, oh, well, yeah, I take this pill, it's the white one or it's the blue one. Okay, so then what else could you do to really investigate what medications they're taking?
Perhaps asking them their prescription sleep or the medications itself.
Yeah. What else could you do?
Maybe the reason. Why are they taking?
Yeah, very good. Because if someone says, oh yeah, I take something for my blood pressure, then you probably think, okay, some of the more common blood pressure medications. Yep. What else could you do? Because I tell you this, 90% of patients that I see don't know what medications they're on. It's common. And so I have to figure out, I have to be, it's like you're a detective. I have to really be strategic and creative in how I figure out what meds they're on. Because if I have a patient that has an irregular heart rate or they have atrial fibrillation and they're supposed to be on warfarin and I don't put them on warfarin, they could have a stroke. So that's why it's very important to really dig deep and
Could you ask them who the usual doctor is and if it would be on the system? I don't know if that's how it works in America, but I think in the UK it's probably all on the same system.
Yeah, that's a great idea. That's a phenomenal idea. So anyone have any other creative ways? Now I'm asking you guys to be creative.
Is it illegal to ask them if they've got any medications in their bag? And maybe
are you sure you're not a doctor? Are you sure?
I'm just obsessed.
Oh my goodness. That is exactly what I was going for, because sometimes patients will have their pill bottles or their significant others will have their pill bottles. And many times I've had patients just give me all their pill bottles and I'm sitting there looking at the label. So yes, we have to be creative because patients are coming to us sick and we have to be able to get the information out of them and not the other way around so that we can best take care of them. So phenomenal. So go ahead.
Just to add to that, on patients not being aware, sometimes they actually have a list of their medications. So some of them are forgetful and they have a list. So in addition to asking whether they have their medications on them and if you can look at them, sometimes they actually have a list for them to remember what medication they take and how frequent.
That is a great idea. Exactly.
Or maybe if they have a picture on their phone.
Yeah, some of them do. Yeah, those are all phenomenal suggestions. So I'm doing this exercise so that you guys are able to think deeper about the questions that you're asking and pulling out what's necessary. Phenomenal. So now that we've done meds, I like to do allergies next because it just makes sense. After you do meds, you just go straight to allergies. So how do you guys ask about allergies? And this is one that a lot of students always forget. So you cannot forget this. This is key, or else you're going to send your patient to the ICU.
Well, most people don't know that they have allergies and they can't remember what allergies they have. So maybe a way of asking them is if they've ever experienced something before with certain kind of medicine, like has any sort of medicine make them swell up afterwards or something, or anything that's happened to them and they can link it back to a medicine or something that they may have taken.
Phenomenal. Exactly. If you're not a doctor, you should become a doctor.
Yes, you should.
And forget that it's not only allergies are not only due to drugs, it can also be to food.
Right, that's true. Yeah.
So you try to ask them if there was anything that they've ever taken or eaten that has caused them to have any swelling, any difficulty breathing, etc.
And why is it important to ask about foods, and what specific foods are you going to be asking about?
Peanuts and shellfish.
Why?
In the event that the patient is admitted.
True. This is, yeah, that's a good point. This is more of a what's the word? Say what I'm thinking type question. So, are there specific medications or shots that you may want to ask about certain foods because of the formulation of the medication or shot?
Yeah, like penicillin, I think some people are allergic to, and it's like commonly used.
Yeah, that's another great idea. If patients can't remember what allergies they have, you can just list common allergies. Yeah, that's great. Penicillin is very great. And sometimes some of the shots or vaccines are prepared with egg preservatives. And if patients have, egg allergies, that it may be contraindicated to give certain shots to certain people. So you always want to think about what are some of the medications I may have to give this patient. And you can even ask if they're allergic to that specific medication, or you can ask about common medication allergies or high yield food allergies. Cool. Okay, so now we're done with allergies. Then I like to go to surgical history. So how do you guys go about asking for surgical history in the patient?
Going to ask about broken bones and anything, and if they ever needed any surgery on any parts of their body, or if they've been in hospital in the past and what happened to them.
Yeah.
Get them to talk.
Yeah, exactly. Yeah, that's how I would ask it. Yeah. And then you can ask if they have any metal in their body. Have they ever had to wear a cast? Have they ever been hospitalized? Because you'd be surprised when patients are like, nope, I've never had surgery. Oh yeah, I was hospitalized because I had chest pain and they took me to a procedure. So you have to be, so are you guys seeing how you have to be creative?
As well, like with some people who have women who've had babies, they might not realize like the cesarean is like kind of like a surgery as well. And like just maybe ask that as well.
Yeah, that's a great idea. Any other creative ways on asking?
Also, if they don't know what surgery they've had, if they come, we can kind of ask like if they have any scars from it, and you can kind of like take a look at what that would kind of be.
Give me an example. What would be an example?
Like for appendicitis, I think you can kind of tell like yeah, I think.
Exactly. Yeah, very good. Very good. And sometimes patients will have like laparoscopic scars, and depending on like where it's located, you can kind of tell, oh, they had their gallbladder removed, or they had, maybe stomach surgery, or they got part of their colon removed. So yeah, that's very good. See, you guys are getting more and more creative as we go along. Phenomenal. So
can I ask a question?
Yeah.
With all these questions, how do you deal with someone who's agitated and tired from all the questions and doesn't really want to answer?
Yeah, so you have to, be able to be creative and think on your feet. And as a neurologist, I get that a lot. Half my patients don't want to talk to me. They're agitated. So part of the training and residency is figuring out, okay, what must I ask the patient? And if the patient won't talk to me, then, maybe I can ask the nurses, or ask EMS, or call a family member. Many times I'm calling family members on patients who are unconscious and trying to get the story. So just because the patient can't tell me doesn't mean I can't get the information. I just have to be that much more creative and strategic. Like, that's a great question. Anyone else have any other questions or comments?
Yeah, I have a question. Like, for example, in our examination for medical interview, right? So, for example, we have like a certain time limit for each patient that we need to interview. So, how do we know like what the important question was, the key of the question that we need to ask, instead of like go through all these things and then like we miss the important thing just because we don't have much time?
Yeah, no, very great question. And as you move along in your training, that's what the training is for, is to be able to get you to go from taking this really long, you're asking all these questions that are not pertinent to the chief complaint, to, when you're done training, then you're only asking, pertinent questions. So for example, I like to teach medical students, when you start first on the wards, I want your interview to be longer than mine, because I want you to be asking all the questions. And then as you become more sophisticated, then for a patient that comes into the emergency room for headaches, I don't care about, what's the word? I don't care about their feet tingling, or I don't care about their constipation. Like, that's not pertinent. But if you want it to be complete in your review of systems, you're asking all that. You're asking about the heart, the lungs, GI, skin. You're asking all of it. So it comes with time. It comes with practice. And really.
Hello, everyone.
Go ahead. What?
Hi, everyone. Sorry, just saying hi.
Oh, okay, cool. Thanks for being on. So it comes with practice. And once you know the complete history taking, then you can start to hone in on your skills. And one advice I have for people who already know the complete and who want to start honing in, that's why the chief complaint is so important. So when you see this patient, a 50-year-old female with headaches, there's certain questions you must ask. And if you don't ask, you may miss something emergently. So what I do before I go into a room, I have I get my white sheet of paper, I write out all the different categories I need to ask. And then I also, do shorthand of questions I need to ask. For example, in the patient with headache, I must ask about onset. Did this come on quickly? Is there a family history of head pain, or is there a history of trauma? Or is the patient having any stroke-like symptoms or any difficulty speaking or swallowing? Because that helps me narrow down my differential. And if you don't know what questions to ask for specific chief complaints, then that's where, do you guys use UpToDate? Does anybody know what UpToDate is?
Yeah.
Okay, so for here in the US, we use a web resource called UpToDate. So I can type in any chief complaint and I'll get a lot of articles on that chief complaint. And some of those articles will say history taken for headaches. So I'll read that article, I'll skim it, and then I'll pull out what questions I need to ask specific to headache. And that's how I'm able to move quickly, but thoroughly and efficiently through my history taking. Does that make sense? So what I would suggest is to find a resource that you could use that can give you the high yield questions you need to ask for specific chief complaints. Does that make sense?
Yep, that's great. Thank you.
Yeah, no problem. Anyone else have any questions before we move on to the next?
I just have a question.
Yeah.
For how to present the case if you had all of the information.
Very good. We will get to that as soon as we're done talking about all the subcategories. But yeah, that's a great question. And the reason why I'm taking you guys through it one by one is because if you prepare appropriately, then you'll be able to present efficiently and look like an all-star. I've had medical students come in day one who were presenting and they were all over the place. And then once I, kind of coached them into having a system, then they would just look at their piece of paper and present in that order. And the attendings or consultants would be like, wow, your presentations have come a long way. And, they're glowing. And I'm like, oh, good job. So I will definitely teach you guys how to take your notes and then use your notes to present. So with that, we're done talking about, we talked about allergies, we talked about surgical history. Then after surgical history, I ask about social history. And the big things I ask about, at least here in the US, is alcohol, smoking, and illicit drug use. And, what's their current place of employment and anything else that might be pertinent. Is there, so.
Should you also ask about sexual partners and history and stuff? If
it's pertinent to the chief complaint. So if a patient comes in and they having vaginal discharge and pain, yes, then I would ask about sexual history. if a patient comes in for headaches, I'm not asking about sexual history. And that gets into a previous question about how can you, how can you take your history taking from 60 minutes to 30 minutes? Because you'll get more sophisticated in your approach. But early on, all my medical students should be asking about sexual history because I want them to ask about everything. Because once you know everything, then you can, what's the word? What's what I'm looking for? Then you can take that complete list and narrow it down and target it to the chief complaint. So,
sorry, can I ask a question first?
Yeah.
I want to ask if a patient doesn't know what allergy they have about the medication, and somehow do we have to do a test first, or what do we have to do first before we write something? Because they don't know what medication they are allergic of.
Oh, so you're saying that the patient doesn't know their allergies, should we do a test to see first before you give the medication?
Yeah.
Yeah, that's a great question. It really depends. It's on a case-by-case basis. And, that's for us, we have pharmacists that we can consult with 24/7. And if I have a concern that the patient may be allergic, I have a patient that comes in that has a lot of immunodeficiencies and, can make them prone, like they have what IgA deficiency and they make them prone to having allergies, then I would just talk to my pharmacist and say, hey, I need to give this medication. I need to give penicillin, for example. And this person is predisposed to, being allergic. What do I do? And so sometimes they, pre-medicate. Sometimes, they could look and give a different drug. So it's really a case-by-case basis. And if you think someone is very prone to developing an allergic reaction, in my hospital, sometimes we have to, we can either pre-medicate with like Benadryl, or a physician will be in the room while this patient is taking that medication, just in case they have a reaction, then I can act quickly. So there's different protocols for such cases, but that's a great question.
Thank you.
Yeah, no problem. So we're done asking social history. And social history is always tricky. So I'm gonna do a quick scenario. Who wants to? I'm gonna pretend to be a patient in the ED. I'll pretend to be this 50-year-old female with headaches, and I want someone to practice asking their social history component. We're gonna role play. I promise I'm not mean. Any takers? Anyone in the audience? This is your chance to.
I'll try.
Cool. Thanks.
Okay. Do you smoke?
What does that have to do with my headaches?
Oh wow. Okay.
She's role playing.
Yeah.
Oh.
My head hurts and you're asking me if I smoke? Like, that doesn't make no sense to me.
I'm just trying to figure out what's happening with you. So I'm just asking.
Is that a question that you ask everybody, or are you just like asking me because you're trying to give me
to ask everyone.
A hard time? Okay, no, I don't smoke.
Do you drink alcohol?
Is this a police station? I thought I came to a hospital.
I know these questions may seem intrusive, but I still need to know.
I just want someone to treat my headaches.
And we're going to get there. But I still need to know if you drink alcohol.
No, I do not. You want to do a breathalyzer to make sure?
No need for that.
Anything else?
Are there any other? Do you know if you take any other drugs?
Like what are you talking about? Now you're calling me a drug addict?
No, I'm not calling you a drug addict. Just trying to find out as well if there's any other drug that you take.
No, there's not.
Anything in your spare time? Anything you inject? Anything you
Oh my goodness.
like marijuana.
What? I need a new doctor. I feel like you're judging me. You're asking me all these intrusive questions and it don't make no sense. I have headaches. Okay, good job. Good job. The reason why I wanted to role play that is because asking those kind of questions, and then when you get to the sexual history, that's even more awkward. You have to develop a finesse in asking these questions. And so I kind of probed you and said, hey, are these questions that you ask everybody? So if you go in and you tell the patient, hey, I'm getting ready to ask you some sensitive questions. These are questions that we ask everybody, and we ask them so that we can better help take care of you. It sets the stage for, I'm going to ask you some sensitive questions. This is not coming out of the blue, and I'm not trying to judge you or stereotype you or categorize you. I just want to help you. And when you phrase it like that, the patients won't come off as defensive. And that, ladies and gentlemen, is the art of medicine. Does that make sense?
About patients who lie. Like, I mean, you're going to find out anyway. Okay, say for example, like the sexual history, and your differential is an STI, right? Well, one of your differentials is an STI at least, but then the patient tells you that they're not sexually active. But then you kind of know in your head that the possibility is there. What do you say in a situation like that?
You stick to the medical facts. If the patient, and I'll take it to drugs, because I've had patients that swear up and down that I don't do no marijuana or I don't do no meth, and then you do the urine drug screen and they're meth positive. I'm not going to go to the patient and say, hey, you lied to me. There's meth in your urine and you said you didn't, because they're sick, and that just doesn't really help with the patient care. At the end of the day, you're there to treat them in a non-judgmental, compassionate way. So you just tell them you stick to the medical facts. You're in the hospital. You got we did a urine drug screen because of your symptoms, and it was positive for marijuana. Would you like some resources to help you get off that? And we're going to treat you so that we can help get you feeling better. And that's it.
And I also feel like if you make them feel as comfortable as possible, they're like less likely to lie to you. And also another thing is just make sure to say it's all kept confidential, like between you and them.
Very good. Very phenomenal. So that's the that's the social history, and that kind of ties into the sexual history. So anytime you're asking those questions, be sure to frame it so that you don't get the patient with the attitude like poor Dee did. So then the next part is that I like to do, then I go to family history. So how do you go about asking family history?
Do you have any heart problem in the family?
Yeah. So with this, you want to be careful, because you can have some patients that tell you all of their family history. My mom had gout. My dad had a mole. My brother had high blood pressure. My sister had this. My cousin had this. My grandma had this. Do we care about all that?
No, you want to know like close relatives.
Exactly.
So, like parents and possibly children if they have any, or siblings.
Exactly. And so with close relatives, do you want to know everything about the close relative?
Just like inheritable diseases.
Yeah. Yep. And then and as you move further along, in order to become more efficient, if my patient comes in for headaches, I don't care that her mom had gout. Like, I care about what are things that could cause my patient's headaches. And then those are the things I'm going to be asking her for in her family history. Is there a family history of cancer? Because cancer can, go to the brain. Is there a family history of strokes or brain bleeds or aneurysms or migraines? So I'm asking specific family history, because when you present, that's what the attending or consultant is going to be asking you for. Did you ask about this? Did you ask about this? Did you ask about that? And that's how you become more thorough. you're thorough and you're asking directed, targeted questions. And go ahead.
How do you word it though?
So you can use the medical terms, or you can say, has anyone ever told any one of your close family members that they had a blood vessel burst in their brain, or that they have head pain, or has anyone in your family ever had like difficulties talking, or like weakness in their arms or legs? So you really break it down and use it in terms that describe the illness that you're trying to get at without using the word stroke or without using the word subarachnoid hemorrhage. You can just say, hey, has any one of your loved ones gone to the doctor because of a headache and they were told they had a big bleed in their brain? We all know that that is probably, you know, a subarachnoid hemorrhage, but we don't have to use that word because they're not going to know that word. So you just describe the symptoms. Great question.
You know, for some people, like if they do have family history and they're like presenting with similar symptoms, and like say their family member died or something, I feel like maybe it would panic them a bit. I don't know how I would like make sure not to like panic them.
Oh, and sometimes some patients will get panicked, and you just have to, again, you can frame the question. I'm asking these questions because I want to make sure that you don't have anything. We just want to make sure that we're thorough and we're complete and that we don't miss anything. So as long as you keep providing reassurance and framing the question, you know, that goes a long way. And sometimes they're still going to be panicked, and that's fine because, you know, you can, sometimes I try and put myself in their shoes. If I'm in the hospital and I have, you know, this horrible headache, and now I have this doctor asking me about cancer, does that mean I have cancer? Like, you know, so sometimes they're still going to panic, but, you know, you can do your best in trying to reassure, frame, and provide comfort to them. Okay, ladies and gentlemen, that is how you take an efficient, effective, thorough patient history. Who wants to recall the order in which you can approach taking the patient history? Starting from chief complaint. Or you guys can do it as a group effort. What comes after chief complaint?
The history of the present illness.
Exactly. And what's a good mnemonic that you could use to make sure you ask all the pertinent HPI information?
Okay.
Exactly. Very good. And what did the letters in old card stand for?
O for onset, and then location, duration, and character, and then V and R for radiate, and then T for temporal, and S for symptoms associated with headache.
Very good. Very good. Very good. And then so after you're done asking the HPI and the old cards, what do you want to ask next? Or what's one, at least in my presentation, what was next?
I don't know next, but allergies.
Yeah, allergies. For me, I like to do the past medical history next. And then after past medical history.
Medications.
Yep, medications. And then with medications, you think, oh, well, allergies make sense. So let's just go to allergies. And then after allergies, what's next?
Surgical history.
Yep, surgical history. Very good. And then what's next?
Social history.
Yep, social history. And what's after that?
Family history.
Very good. And that, ladies and gentlemen, is your history taking. So right now, if you go to my YouTube channel and see the live stream, you will see all those different subsections: the chief complaint, HPI, old cards, review systems that goes into the HPI, then past medical history, meds, allergies, surgical history, social history, family history. I'm going to reset the room because we have a lot of new people in. My name is Dr. Eseosa.ighodaro, and I'm a neurologist and a neuroscientist at Mayo Clinic in the United States. I do a lot of online free teaching for medical students because I love teaching and I love neurology. And I've been doing these kind of rooms trying to help pre-med students and medical students and interns think like a doctor. And the things that I teach are things that, don't show up on your board exams, but these are practical things that you could use when you're on the inpatient service. And a really phenomenal thing that I'm doing, this is the first time I'm doing this, is that I'm integrating Clubhouse with Zoom and YouTube. So as we've been discussing, I have been using a whiteboard to take down notes so that you guys get the highlights of what you need to take away from this discussion. So if you go to YouTube, type in Dr. Eseosa.ighodaro, you'll see my YouTube channel. If you go to my Clubhouse, you'll see a link called Linktree. You can type that in. That will take you to my YouTube channel. Be sure you subscribe so that you can stay up to date about my live streams and the next conversations that I will be hosting on Clubhouse. So with that, we had another audience or speaker or someone on stage ask about how do you present this? So if you go to my YouTube channel, and right now we're just talking about the data collecting, we were just talking about the patient history. We haven't talked about vitals or physical exam. I'll talk about that in the next room or next conversation. But if you take your piece of paper and you write in the order that you set it up in a way, top of your page, you have chief complaint, and then you ask your questions in this order. And when I take notes, when patients are talking to me, I don't write everything they say down. I just write bullet points. I don't need to write down a full long sentence. Oh, patient has a headache that is in the front and the back, and they have nausea and vomiting. I don't do sentences. You don't have time for that. What I do, and I can show you guys an example on YouTube, is, I guess I'm good to erase this. Let me see. Give me 1 second. Okay, yeah. So I'm going to erase this. So what I do is, so a patient comes in and they say that they have head pain. They say the head pain is 10 out of 10. So I'm just writing bullet points. They have nausea and vomiting. And I'm also doing shorthand. If you can see this on my YouTube channel, they say it's hurts in the front bilaterally. They are sensitive to light and sound. So then I write photo and phono. So you'll learn to be efficient and quick at note taking by doing shorthand and by writing in bullet points. And you write the word that is the most important so that when you see that word, you can put it in a complete sentence. So some of the things we talked about is that it hit maximum intensity, it's throbbing, and it came on all of a sudden. So if you guys see my YouTube channel, do you see how I'm not writing sentences? I'm just writing bullet points. So when I go and present, I can take all these words and put it into a sentence while I'm talking to the attending. So if someone is looking at my YouTube channel right now, who wants to try and take the words I wrote and present the HPI part? Any brave souls? You guys are all brave. Now it's the time to practice. There's no grades. I don't know what school you went to. So now's the time to practice so that when you are on service, you're miles ahead. Who would like to practice? Do you guys see my notes on YouTube?
I could probably try.
Cool. Thank you.
Okay. So 50-year-old presented with a bifrontal headache with 10 out of 10 severity, with associated nausea and vomiting, photophobia, and I'm not sure what the other symptom is. The last one that you wrote.
Okay, let me. Do you see it now? I'm rewriting it.
Yeah, I see shopping.
That was phenomenal. That's exactly how I would have said it. And see, so that's why you want your sheet to be to be done in a very systematic, orderly manner, so that as soon as you come out the room, you can present your case. You don't have to go. I've seen students who go and rewrite their notes again. I'm like, that's a waste of time. Like, you should be able to come out and present your patient with the information you've gotten in the room. Because I've been in the intensive care unit, and as soon as I'm done asking the patient history, the consultant is right there saying, okay, present to me. So that's why you want to be sure you find a system that works for you, so that if they ask you to present, you're ready as soon as you come out of the room. Does that make sense? Anyone have any questions?
Hi, Dr. Eseosa. Thank you so much for this presentation. It was really interesting. So I'm actually not in medical school yet. I'm pre-med, but I had one question about the difference between like the duration and temporal in the old CARTS acronym.
Mm-hmm.
Like what's the question you would ask for like duration versus temporal?
So how I interpret it is like duration would be, okay, how long did this head pain last? Has it been happening for an hour, 2 hours, 3 hours? And then for me, I think of temporal is it intermittent? Is it constant? Does it wax and wane? That's kind of how I think about it.
Okay, thank you.
Yeah, no problem. Thanks for asking questions and being on stage. So does anyone have any other questions, comments, or next topics, or were you guys able to view the whiteboard, or were you having difficulties finding it?
Hi, Dr. Eseosa. This is Venk. I'm one of the EM consultants. You and I worked.
Yeah, we did. Oh, small world. Get ready to follow you.
Nice, organized presentation that you're offering these young physicians to be.
Thank you.
Everyone, I hope you're enjoying it, and I think hopefully you find that people are very understanding, and you can practice and learn the different nuances of presentation styles, different specialties and contexts. I know when I was a student, my very first rotation, I kind of botched my first presentation, and I was really self-conscious about it. I think the resident was pretty stressed out and didn't also handle my botched presentation very well either. And it really kind of stuck with me for a while and took a while to overcome. And I think having a chance to have a discussion like this with somebody who's done it and in a relatable fashion, hopefully saves you all those headaches. And I just wanted to say I wish you all well and appreciate the time you're putting in to do this, both to moderate and do this, Dr. Eseosa, and all of you as learners as well.
Thank you. Thank you so very much. He was my emergency medicine consultant back in December of my intern year. So I remember presenting to you as well. So thanks for being on and giving that phenomenal feedback and encouragement to everybody. I'm still practicing my presentation skills. I'm not perfect by any means. And it's something that, it's part of the art of medicine. You get better as you go along. And the biggest thing that I learned as an intern is finding a system. And if you guys can find your system now and do things in a very systematic way, when things get busy, especially in the emergency room, you'll have something to fall back on and you won't forget. So I'll be doing these these kind of rooms at least once a week. I'll be focusing a lot on neurology symptoms. Some of the rooms I've done previously are like how to do with like patient coming in with headaches or with weakness or stroke-like symptoms. Because a lot of these types of chief complaints are things you'll see on your step 1, step 2, step 3 exam, and then also, in the hospital setting as well. So be sure you follow me on Clubhouse, you follow me on YouTube and my other various social media platforms so that you could stay up to date on different rooms. Feel free to reach out. And if there's specific topics in neurology that you're interested in me presenting, let me know and I can, make time to present that as well. And make sure you follow the aspiring MDs because the 3 founders have done a phenomenal job with some of the recurrent lectures that they do. They really try and focus on pre-med and medical students and what are some of the high yield things like how do you finance medical school, how do you apply to medical school, MCAT studying, mentorship. They do a lot of really great free content. And so make sure you follow the aspiring MDs as well. And that's basically my closing. Does anyone else have any last comments, suggestions, or anything like that?
Right. Thank you. That was absolutely wonderful. Coming from somebody from the other side, the patient, this is excellent. I really appreciate this. Thank you so much.
Oh, well, thank you. Thank you for being on. And thank you for giving us your unique perspective from the patient side as well, because my job is to serve you and serve patients. So I'm glad that you gave us your opinion and your perspective so that we can all be better healers. With that, I will close this room and everyone have a great evening and I will see you in the next Clubhouse session.
Thank you. Bye, everyone.
Bye.
Thank you so much. Thank you. Thank you.
Hi, how are you? Hello? Hello?
Hi.
Hi. Such a small world.
It is very nicely done. I was just eavesdropping there and just wanted to let you know, feedback for you that it was very well organized, and I wish that I'd had that experience when I was early on. And you're doing a wonderful job. I didn't have access to the whiteboard, so I haven't been able to see that, but that sounds really neat too.
Thank you. Thanks. I really appreciate it. And I haven't met a lot of Mayo physicians on here. So if whenever you're on here and you want to do a room together, that'd be phenomenal.
Anytime you would like another opinion on stage with you, just invite me. I'm new to this, and I'm just finding my own voice, I guess. I have a lot of different passions. Of course, education is one of them, but I haven't found my niche. You've clearly found yours. It's I was reading about all the things you're doing on your profile.
Thank you.
It's really wonderful.
Thank you.
But yes,
thank you.
I'm new at it. I just joined maybe 5 days ago, something like that. So I'm not even sure how to do many of the activities.
Yeah, I love Clubhouse. Clubhouse it's like I'm able to, do these kind of things, in my, in the comfort of my own home. And I've been able to reach out to not only medical students, but so many different physicians from across the world. It's been phenomenal.
Absolutely.
Great.
Yeah, I haven't, I don't think I've had a room that really inspired me just yet, but I've listened to a lot of them, and the most interesting thing that's happened is I joined one on fatherhood, and it was towards the end of the room. And right after me, the next person was Barack Obama. At least that's what it says. And the picture was there, and the whole room kind of came to a stop.
What?
But the person behind that account didn't say anything, so I don't know. I don't really